Welcome to Experience Army Medicine Interviews. Our mission is to interview local medical professionals within the Army so they can detail their impact in medicine today. Today's interview is with Captain Kai Combs, 61 Hotel, family practice doctor. She hails from Weed Army Community Hospital, Fort Irwin, California.
Kai Combs. I am a captain. My AOC is 61 Hotel, family medicine physician. I originally from California, Northern California, and I come from a big military family. So both of my grandparents who raised me were in the military. My grandfather was in the Air Force and my grandmother was in the Army. So when I decided I wanted to be a physician in college, I was just looking for opportunities to help pay for med school, and the military was one, and I was like, this is the way to just continue the legacy, so that's why I joined. So I really enjoyed science. I majored in chemistry at Xavier in New Orleans, and I originally was going to think about being a pharmacist, but I just wanted more direct patient care, talking to people, trying to influence a whole community of people. I was really interested in health disparities and health inequality, so it was a way for me to just reach out to more people of all ages and, change the world, basically. Most fun Army experience, probably when I went to a course down in San Antonio. It was called C4, and we would do things like maybe that you might see in the field, so like, carrying dummies up and treating dummies and trying to find out ways to treat a patient through trauma, just in case you were deployed. So I would say that's the most fun Army experience. So I guess along those lines, any kind of like ATLS or C4 courses are very specific for military that you wouldn't really see in civilian world. And then as far as other courses and conferences, the Army will usually pay for you to go and attend those conferences and things like that. Here, it varies. So you either have an outpatient or inpatient schedule. On outpatient, I wake up at 6:30, I come in, and 7:40 we're starting clinic days. And then I have maybe about 20 patients of clinic, and then I can go home. Inpatient, it's a little different. We are on call, but we get to take home call. So 7 days, 24/7, you can get a call saying, hey, we need you in the hospital, come check on this patient. You might need to admit them. But the good thing is that you get to be at home while you're doing this, so you don't have to be here the whole time. And then you just come in, handle what you have to do, and then go back home. So far, it's been good. There's some challenges with having to move. So I originally, after I finished med school, went from Northern California to Georgia, which is complete opposite side of the country, when all of our family is in Northern California. And then I also had a baby that month before I had to move. So it was kind of similar here too. When leaving Georgia, I had a baby, and then 2 months later, we moved here back to California. So it's a little bit taxing for us, but we do enjoy that we get to be a little bit closer to family now, and we get to see new places that we never would have been if we weren't in the military. So far, I guess it would be Fort Irwin. I did enjoy Fort Eisenhower, but I think my hours were a lot different there because I was a resident. And here, I feel a little bit more relaxed. I'm kind of getting into the swing of things, and it's nicer to be closer to family and drive. I think it can be a little bit more challenging, just because on top of just resident duties, like the long hours, working possibly up to 80 hours a week, we also have to do our Army requirements. So taking the ACFT, doing your PT when you are told to, doing your trainings, lots of trainings, which a typical civilian resident might not have. Yeah, when I'm free and I have my 3 days weekends after my call, we like to travel. We like to go to the amusement park. So Disneyland's a couple hours away. We like to just try out new restaurants that are nearby. And just explore what else is around. Well, I know I would gain wherever, I could live wherever I want to. What I would have to give up is, I guess, just this community. It's a pretty small community here at Irwin, but this is probably the safest place we've lived. Everyone knows everyone. Everyone is very welcoming and friendly. And the schools here have been really nice and helpful for my kids, so that's good. So when I was actually a freshman in college, they had a recruiter come and talk to the pre-med students about HPSP. At the time, I thought it was really cool because there's a possibility you can go to Hawaii. And I was like, oh, that'd be nice to live there. And then I talked to my grandmother about it, and she was like, yes, that's the way. If you're going to medical school, that's what you should do. So when it came to senior year and I was actually applying to colleges, a recruiter came back and I told him I was interested, and he gave me a little bit more information. So I applied and luckily got accepted. And then after I got accepted to medical school, they were like, yes, you can do this. So I did it. And then through medical school, they just paid for everything, including like books. You do have to do some training when you get some time off, like a BOLIC. And I went to Fort Sill for one of them, and I think the other one is in San Antonio. And yeah, you basically play Army for a little bit, and then you come back and finish up medical school and apply to residency. And I was able to attend a Army residency. Some people attend civilian residencies. And then, yeah, I went to Fort Eisenhower now. It was Fort Gordon, but it is Fort Eisenhower now, and finished my family medicine residency. So I considered pediatrics, but in the end, I applied family medicine. The process was you can do like active duty rotations when you're in your fourth year of medical school. So you go and visit a place like Fort Eisenhower, and you work in the clinic, you work in their inpatient service as a medical student just to see it and interview with them. You could also do phone interviews, which a lot of people do. And then you put out your rank list, so you rank the programs which you're considering matching into. Back in my day, it was like kind of through email, but I don't know if they've changed it. You find out pretty early. I believe we found out we matched in December, compared to civilian where you match in like March, and then you find out then. So we had a pretty good idea where we were going pretty early. Yeah, we had a good relationship. My recruiter, I forgot his name. I feel bad, but we were in New Orleans. Yeah. I'm sure he's probably out by now, but yeah, he was very nice. He was very helpful. He was walking me through every individual step. He was checking my personal statements, making sure it went well with the program, making sure I was really committed to doing it. He wasn't as annoying, I guess, as a lot of recruiters are put out to be, but he did his job. He got me in there, so it worked.
Thank you for listening in on our Experience Army Medicine interviews. We hope that these interviews help encourage your own path into a healthcare career. If you enjoyed the interview, please don't forget to like, follow, and share our content as we continue to dive deeper into Army Medicine. Be all you can be Army Medicine.